Hello, everybody, and welcome to NESA MP. It's Dr. Rojas here, and today we're going to be discussing viral exanthems. I give you all of the information you need to be successful in your schooling and in preparation for your boards. And at the end of each of the modules, I present a fast facts slide with additional information on diseases that we've covered or diseases that we have not covered but fall under this specific module and the information you need to know. So let's go ahead and get started. The first of the exanthems that we're going to talk about is measles, otherwise known as rubeola, and you need to be aware of both of the names. So the way that I think about measles is it has one L, and so does rubeola, so go ahead and match those two up. So measles is a viral exanthem that is transmitted airborne, saliva, and mother to baby. The risk factors for all of these exanthems are going to be the same: exposure, non-vaccination status due to age, or choice. The causes for measles is going to be the paroxysmal virus. Manifestations are going to initially present with Koplik spots. And this is a very specific keyword for measles. So go ahead and jot that down for your memory. And it'll be present initially before anything else presents. Soon after, the 3 C's will follow: a cough, conjunctiva, and coryza. And remember that coryza is the runny nose. Then the patient will develop a rash 2 to 4 days after these initial symptoms present, and the rash will begin on the face and then spread cephalocaudally, or from head to toe. Safety issues you need to be aware of include seizures due to very high fevers. The treatment is going to be symptomatic in nature, as this is an exanthem that is viral, as are exanthems. Other information to know for measles is the MMR vaccine helps protect against measles. However, it cannot be administered to a patient until they have reached 12 months of age, as it is a live vaccine. So just keep this in the back of your pocket. Next up, we have rubella. And the way that I remember this exanthem is rubella has 2 L's, and the other name for rubella is made up of 2 words, German measles. This is a viral exanthem that is transmitted airborne, saliva, mother to baby, same risk factors as measles, exposure or non-vaccination status. The cause is the rubella virus. Manifestations are key for any of these exanthems, so make sure you understand which manifestations go along with which exanthem. So for manifestations for rubella, they're similar to measles, however, they're short-lived and generally not as severe. This usually lasts about 3 days. The patient will have general malaise, like a headache, fatigue, muscle aches, and lymphadenopathy, which is specific to rubella, so go ahead and make sure you know that. After the initial manifestations, the patient will develop a red, pinkish rash that begins on the face and spreads cephalocaudally. So remember that rubella and measles spread cephalocaudally. Okay. Safety issues, again, avoid in pregnant people from exposure due to the risk of miscarriage. Treatment is symptomatic as it's viral. The MMR vaccine also helps cover against rubella. However, again, it can't be given for patients until they have reached 1 year of age due to it being a live vaccine. Varicella, otherwise known as chickenpox, is a viral exanthem that is transmitted airborne, saliva, or mother to baby. The risk factors are the same as the previous ones. Its cause is the varicella zoster virus, and you need to make sure you understand that, because later on in dermatology, we're going to talk about the herpes virus and some other viruses that can oftentimes be confused with varicella. Manifestations are a blister-like rash with the fever, pruritus. There are 3 general phases. First, you'll have a erythematous papule, followed by the vesicular rash, which is then followed by crusting and scabs. Safety issues, reactivation of the virus in the herpes zoster form, so shingles in older adulthood, we have to know that. The treatment, again, is symptomatic due to its viral nature. Erythema infectuosum is otherwise known as fifth disease. It's a viral exanthem that spreads through respiratory droplets or through direct physical contact. Again, risk factors include exposure. Causes is the parvovirus B19, and you need to know this. Manifestations are a fever followed by a rash that is bright red and macular in nature that appears lacy. And that's a key word for erythema infectuosum, and you need to know that, lacy. It appears on the cheeks, followed by the extremities, and doesn't really affect the rest of the face. So just the cheeks, and then it moves down to the extremities, not really affecting the rest of the face. The treatment, again, is symptomatic in nature. Next up, we have roseola or Exanthems subitem. And it's a viral exanthem that spreads through saliva, airborne, or physical contact. The risk factors are exposure. The causes is the HHV type 6 or 7. And the way that I remember this exanthem is roseola has an S in it for super high fevers. And if I remember super high fevers, then I remember herpes. And I know that it doesn't really click together, but if you just remember the super high fevers, you'll remember the key characteristic of this exanthem. An extremely high fever between 101 and 106 that lasts a handful of days, usually 3 to 5, and it's followed by a rash that begins on the chest and then goes to the extremities. Nagayama spots are also specific to roseola. Transmission can occur if the fever is still present or it has not been 24 hours since it has broken. So a child can be sent to school after the fever has subsided and it's been at least 24 hours, regardless of whether there is a rash or not. So remember, 24 hours fever-free. The treatment, again, is symptomatic in nature. Hand, foot, and mouth disease is a viral exanthem that is spread through airborne, saliva, or physical contact, like much of the other exanthems are. The main risk factor is exposure. The cause is the Coxsackie virus A16. And again, you need to know the causative agents of all of these exanthems. Manifestations are going to include a fever and abdominal pain, followed by gray-white vesicular rashes on the hands, feet, and mouth, as the name of the exanthem indicates. They can even have blisters within the oral mucosa that are extremely painful. They're going to look like little white pimples that sit on a erythematous base or a red base inside of the mouth. The safety concern that we have for hand, foot, and mouth disease is going to be dehydration due to the oral mucosa being in an altered state. So we're going to make sure that we're treating the symptoms and keeping the patient well hydrated and preventing any dehydration, as well as monitoring for signs of dehydration. Okay, we've reached the viral exanthems fast fact sheet. And it's important that you understand everything on this section. I've covered all of the viral exanthems that are highly tested on, but there's still some additional information that you need to know. So for some of these exanthems, we use fifth disease, we use sixth disease. Well, where does it come from, and how do we know which ones are which? Well, we know that all exanthems have a number assigned to them, so let's quickly go over them. Measles is known as first disease, and it's caused by the measles marble virus. Scarlet fever is known as second disease, and it's caused by streptococcus, and a keyword for scarlet fever is going to be sandpaper-like rash and strawberry tongue. Rubella, otherwise known as German measles, is the third disease, and it's caused by the rubella virus. Duke's disease is fourth disease, and it's caused by Coxsackie virus. Erythema infectiosum, otherwise known as fifth disease, is caused by the parvovirus. Roseola, remember that super high fever exanthem, is sixth disease, and is caused by the herpes virus. Other things to remember is if the vesicles are on the hands, feet, and mouth, you want to think of hand, foot, and mouth disease. For varicella, they can return to school once all of the vesicles have crusted over. Another key term for varicella is different levels of healing. So if you get a test question saying which exanthem would be manifested in different levels of healing, it would be varicella, because remember it has those 3 stages. A lacy rash is descriptive for Fifth's disease. Roseola, the child can return to school after 24 hours of being fever-free. Measles and rubella spread from head to toe or cephalocaudally. Varicella starts on the abdomen and then spreads to the face, arms, and legs. Fifth's disease starts on the cheeks, but not the rest of the face, and then spreads to the extremities. And roseola starts on the abdomen and spreads up to the neck and the arms and legs, not the face. So that's the only one that doesn't really affect the face, and it's important to know that. A few other key things are Koplik spots are specific to measles. You need to know that. Remember your Nayagama spots. And remember that you need to understand how a rash is described. If they're talking about macular, it's flat, it's flush to the skin. If they're talking about papules, it's popping out of the skin. So flat to the skin is your macules, and papules, they pop, so they're off of the skin. Alrighty, so go ahead and review your dermatology terminology when you are reviewing viral exanthems. And I will be covering dermatology in another section, so you can piece them together, but your viral exanthems are crucial. You need to understand them. This is highly tested on material, guys, so you need to make sure that you understand what they're caused by, the clinical manifestations, how do we treat, and key terms that when you're reading a case study or a vignette or the question, if you see Koplik spots, you stop. No matter what else the question is telling you, you know that it's referring to measles. Alrighty. Nayagama spots, same thing. If we're talking about a sandpaper rash, same thing, right? Scarlet fever. So make sure that you understand those key terms. I hope this module was helpful. Don't make it more complicated than it needs to be. My content reviews what you need to know to pass your boards. Remember, study my material, hear it over and over and over again, and trust yourself, you will pass. Thank you so much for joining me.